This is Dr. Kohli. I'm going to discuss some questions with answers on GIT in pathology. These questions and answers are very good for medical students, undertaking step 1 examination, and even for residents going to take board examinations. My first question is, which of the following is true regarding Barrett esophagus? There are some of the options. They are intestinal metaplasia with goblet cells on biopsy is a requirement for the diagnosis. Next options are it is not existent in Hispanics, higher incidence in females than males, obesity is not a risk factor, short segment is not associated with increased risk for malignancy. The best answer is intestinal metaplasia with goblet cells on biopsy is a requirement for the diagnosis. And regarding the short segment of the Barrett esophagus, it has increased risk for esophageal adenocarcinoma. Other things one can remember regarding Barrett esophagus is it has higher incidence in males. Let us go to the number 2 question. What is the most common site in the GIT to be involved by endometriosis? Terminal ileum, right colon, left colon, right and left colon, retrosigmoid colon. These are some of the options. Endometriosis has a wide distribution within pelvis and abdominal cavity. Microscopically, one should see endometrial glands and stroma. Presence of hemosiderin-laden macrophages in stroma is an additional diagnostic finding. Retrosigmoid colon is the most common part of GIT tract that is involved. So in this question, it is very important for the students to remember that the most common site in the GIT for the endometriosis is retrosigmoid colon. Question number 3 is, in which area of stomach adenocarcinoma most likely to rise? Pyloric area, cardia, fundic area, all areas they are affected equally are both pyloric and cardia. The best option and the answer is pyloric area. 40 to 50% of gastric adenocarcinoma involve mucosa of pyloric area. Period. 15% arise in cardia, 40% arise in fundic area. 10% of patients involve multiple areas of stomach. So this is a very straightforward question that pyloric area is the most common site for stomach adenocarcinoma. Let us go to the question number 4. This is also a very common question often asked in the medical school, step 1 and the board examination. Which of the following antibodies is commonly elevated in patients with ulcerative colitis? Some of the options are PANCA, PANCA, anti-RF, anti-endomysial antibodies, anti-SSA, and or SSB. The last option is anti-dsDNA. The answer is B. ANCA. Serum level of intraneutrophil cytoplasmic antibodies are often involved in patients with ulcerative colitis. Anti-SSA and SSB antibodies are related to Sjogren syndrome. Anti-dsDNA is most associated with SLE. Anti-RF are associated with rheumatoid arthritis, and endomysial antibodies are seen in celiac disease. So one has to remember that antibodies which are elevated in ulcerative colitis is B. ANCA. Next question is, it looks very easy, but when it comes in the examination, often the students get confused. The question is, the most common neoplasm of the appendix is which of the following? Adenoma, neuroendocrine tumors, mucinous adenocarcinoma, hyperplastic polyp, squamous cell carcinoma. The answer is neuroendocrine tumors. They comprise nearly 75% of all benign and malignant tumors of the appendix. They are more common in females. They are usually very small, less than 1 centimeter in size, and are located in the tip of appendix. Next question is regarding amyloidosis. The following statement is true regarding amyloidosis involving GIT tract. Options are: GIT involvement is common in all types of systemic amyloidosis. Next options are: vascular involvement by amyloid causes fragility and rupture of the vessels, which can lead to ischemic colitis. Histochemical stains used for amyloid include Congo red, toluidine blue, crystal violet, and thioflavin. The most common area of GIT tract biopsy to diagnose amyloidosis is the rectum. And the last option is all of the above. In this question, the answer is all of the above. But the most important thing to remember is to make a diagnosis of amyloidosis, the area of GIT tract most commonly biopsied is the rectum. Next question is, the following statement is true about celiac disease, also known as gluten-sensitive enteropathy. The options are: in adults over 40 years, the most common presentation of celiac disease is diarrhea and malabsorption. Second option is individuals with celiac disease share the major histocompatibility complex class 2 HLA-DQ2 or HLA-DQ8 haplotype. Third and fourth options are: the prevalence of celiac disease in the United States is approximately 1:1,000. Gluten is a water-soluble protein component of wheat. And the next option is all of the above. So here the students, sometimes they answer all of the above. But the best answer is Individuals with celiac disease share the haplotype HLA-DQ2 or HLA-DQ8. In adults over 40 years, the most common presentation of celiac disease is not diarrhea and malabsorption. The common presentation is iron deficiency anemia. Thank you. We'll discuss more on GIT and other system questions and answers in the next videos.